Hey folks, welcome to the Dr. Deals podcast, where we talk about healthcare business transactions. I'm Nick Newsad. Today, we're going to talk to Kevin Baker about trends in emergency medicine. Kevin Baker currently serves as a Director of Business Development at Emergency Care Partners, or ECP. At ECP, Kevin focuses exclusively on driving inorganic growth opportunities for the company, which is one of the largest single specialty emergency medicine practices in the country. Prior to ECP, he spent the last decade supporting multi-site healthcare businesses in various finance and M&A roles throughout the country. Kevin, thanks for visiting with me today.
Thanks for having me, Nick.
Now, I'm very curious, at this point in 2026, what would you say has been the impact of the No Surprises Act on emergency medicine docs?
Yeah, it's a great question. So the No Surprises Act, or NSA, was introduced with very good intentions, right? Protecting patients from unexpected out-of-network bills. But its impact on emergency medicine physicians has been profound and, frankly, deeply concerning for our business. Emergency medicine is unique in that physicians have an ethical and legal obligation to treat every patient who walks through the door, regardless of their insurance status or network affiliation. And so the NSA, however, has significantly shifted the financial leverage in reimbursement negotiations away from physicians and toward insurance companies. And so the independent dispute resolution process, or IDR process, that was built into the NSA law was supposed to serve as a fair arbitration mechanism. But in practice, insurers have used it to, frankly, drive down reimbursement rates, often anchoring payments to artificially low benchmarks called the QPA. And the result is that many emergency medicine groups are being reimbursed at rates that do not reflect the complexity or the criticality of the care they provide. So over time, this puts significant financial pressure on independent emergency medicine physician groups, threatens the viability of independent practices, and ultimately kind of reduces access to high quality emergency care. Particularly in rural and underserved communities that can least afford it. So the physicians who show up every day to care for the sickest patients, deserve a system that fairly compensates them for the work. And right now, there are certainly some shortcomings in the No Surprises Act.
And we've certainly seen that effect in the market. I heard that American Physician Partners closed its entire business nationwide and that Envision split itself back apart during its bankruptcy and restructuring. So how do shakeups like those, how do those affect emergency medicine docs and local community hospital emergency departments?
Yeah, you're absolutely right, Nick. And, these collapses that you just mentioned, they send shockwaves through the emergency medicine community. And their effects are still being felt today. When large national physician staffing organizations like APP and Envision, face financial collapse, it's not just a corporate story. It's a human story, that plays out in emergency departments across the country. For emergency physicians, the immediate impact can be severe. Delayed paychecks, broken contracts, uncertainty about their future employment. And in some cases, showing up to work not knowing whether their group, still exists. And so these are professionals who dedicated their career to one of the most demanding specialties in medicine. And, they deserve stability, not chaos born from over-leveraged corporate structures. And so for hospitals and local emergency departments, the fallout is equally disruptive, right? When a staffing partner collapses, hospital administrators are suddenly scrambling to find coverage for one of their most critical service lines, often with little notice. Patient care does not pause for a corporate restructuring, right? And so the emergency department doors stay open regardless, and that creates enormous operational and financial strain on hospital leadership. And so what these shakeups ultimately reveal is the danger of prioritizing growth and financial engineering over the fundamentals of physician-centered care. So organizations that are built on sustainable business models, strong physician relationships, and a genuine commitment to their clinical partners are far better positioned to weather the storms that inevitably come.
Fascinating. So one last question. The last few years, we've seen just an explosion of advanced practice providers. At the rate we're going, I think we're going to have more nurse practitioners and physician assistants than physicians here in a few years. From your perspective, what is the role of nurse practitioners and physician assistants, or physician associates as they call them now, in hospital emergency departments?
Sure. So the role of nurse practitioners and physician associates or assistants, often referred to collectively as advanced practice providers or APPs, in hospital EDs has expanded significantly over the past decade, and for good reason. As patient volumes continue to rise and physician shortages persist across the country, APPs have become an essential part of the emergency medicine care team. Today, APPs in emergency departments are doing far more than handling lower acuity cases. They're conducting thorough assessments, interpreting diagnostic results, managing complex patient presentations, and working side by side with emergency physicians to ensure that patients are receiving timely, high quality care. And so in many departments, they play a very critical role in addressing certain KPIs that we care about, such as door to provider times, improving patient throughput, and alleviating the burden on physicians so that those physicians can focus their attention on the most critically ill, highest acuity patients. That said, the conversation around APPs in emergency medicine is nuanced. The quality of their integration depends heavily on the level of collaboration, supervision, and institutional support that they receive, right? When APPs are embedded in a well-structured team model with clear communication, significant physician oversight, and a culture of collaboration, the results for patients and departments are excellent. And so the key is ensuring that scope of practice is thoughtfully aligned with training and experience, and that the physician APP relationship is one of genuine partnership rather than just a cost-cutting substitution.
Terrific. Kevin, how can folks get a hold of you?
Sure. So I'm very active on LinkedIn. So they can find me on LinkedIn, as well as our website through Emergency Care Partners, which is www.ecp.net. Additionally, folks can reach out to me directly via my cell phone, 518-268-8077, or my work email, kevin.baker@ecp.net.
Emergency medicine sounds like a challenging field all around, so please reach out to Kevin directly if you need help in that field. And let's do some doctor deals.